The global obesity epidemic is no longer just a matter of weight or waistlines. It is becoming a major accelerator of cancer incidence worldwide, threatening to reverse decades of progress in cancer prevention and control. As waistlines expand across both developed and developing nations, so too does the shadow of malignancies that are increasingly driven not by infections or toxins, but by excess body fat. What was once viewed as a lifestyle concern or a risk factor for diabetes and heart disease is now emerging as a potent and under-recognized catalyst for multiple forms of cancer. This is not a slow burn crisis. It is a rapidly advancing, epidemiologically confirmed threat with serious implications for public health systems, economies, and life expectancy across the globe. Mounting evidence has confirmed that obesity is causally linked to at least 13 types of cancer, including some of the most lethal and prevalent: colorectal, pancreatic, liver, endometrial, breast, postmenopausal, kidney, and esophageal cancers. Unlike smoking, which has seen global rates decline due to strong public policy and awareness campaigns, obesity continues to rise relentlessly in all age groups. This means that cancers driven by obesity are not just increasing, they're doing so in populations that are younger, more vulnerable, and less likely to be screened or diagnosed early. In several high-income countries, obesity-related cancers are now outpacing smoking-related cancers in younger adults, a stark indicator of how rapidly the landscape of risk is changing. The biological mechanisms linking obesity to cancer are multifaceted and disturbing. Excess adipose tissue is not inert. It functions like a hormone-secreting organ, pumping out inflammatory cytokines, growth factors, and excess estrogen. These substances fuel cell proliferation, reduce apoptosis, the natural death of damaged cells, and create a microenvironment that favors malignant transformation. Visceral fat, in particular, is especially dangerous, surrounding organs and disrupting metabolic and immune function in ways that silently promote tumorigenesis. Chronic low-grade inflammation and insulin resistance, hallmark features of obesity, only amplify these effects, setting off a chain reaction of metabolic disruptions that raise cancer risk significantly, even in people who might otherwise consider themselves healthy but carry excess fat. The burden of obesity-related cancers is not evenly distributed. In high-income countries, sedentary lifestyles, ultra-processed diets, and screen-dominated leisure time have created a perfect storm for weight gain and cancer development. Yet the impact is even more worrisome in low- and middle-income nations. These regions are now experiencing a dual burden of disease, undernutrition and obesity coexisting within the same populations, sometimes even within the same households. As Western dietary patterns and urban lifestyles take hold in these countries, cancer infrastructures remain fragile, screening programs are limited or non-existent, and most patients are diagnosed at late stages when survival rates are low and treatment costs are prohibitive. In this context, obesity becomes not just a cancer risk but a death sentence. Pediatric obesity is another silent disaster unfolding in plain sight. Children who are obese are not only more likely to become obese adults, but they also carry metabolic derangements and inflammation from an early age that could increase their risk of developing cancer in their 30s or 40s, a time when most individuals are not considered cancer risks and thus remain unscreened. This delay in detection translates directly into more advanced cancers, higher treatment burdens, and poorer outcomes. Moreover, the stigma and psychological toll of both obesity and cancer further marginalize affected individuals, reducing their willingness to seek medical care and compounding the tragedy. Perhaps most alarming is the fact that many people remain unaware of the link between obesity and cancer. Public health messaging has focused heavily on cardiovascular disease and diabetes, while the cancer link has often been relegated to scientific journals or specialist conferences. This disconnect between evidence and awareness has delayed meaningful policy responses. Taxes on sugary drinks, restrictions on junk food advertising, and urban design that promotes physical activity are still lacking in many regions. Meanwhile, bariatric surgery, one of the most effective interventions for reducing cancer risk in severely obese individuals, remains inaccessible to most due to cost, stigma, or policy neglect. We are already seeing the consequences. Cancer is projected to become the leading cause of premature death in many parts of the world within the next decade. A growing proportion of this burden will be attributable to obesity, and without urgent action, these numbers will escalate. The economic cost, already measured in hundreds of billions of dollars, will spiral further as more people require prolonged, expensive cancer care that could have been avoided with earlier preventive action. The social cost: families devastated, productivity lost, healthcare systems overwhelmed, will be incalculable. This is a global warning. We cannot treat cancer as though it exists in a vacuum, nor can we afford to ignore obesity as a major modifiable risk factor. Prevention strategies must shift upstream, targeting the social, economic, and environmental conditions that drive excess weight. Food systems need reform, health literacy must be elevated, and political will must be mobilized to take aggressive, unapologetic action. Cancer prevention is no longer just about avoiding tobacco or wearing sunscreen. It is also about confronting obesity as the public health emergency that it truly is, before it fuels a surge of preventable suffering that we are utterly unprepared to manage.